Good afternoon, everyone. I'm Amanda Kunkler, and I'm the Community Engagement and Advocacy Officer at COTA Victoria. Welcome to today's information and skills session about policy development here at COTA Victoria. I'd like now to call on our COTA Victoria President, Greg Nichols, to provide the acknowledgement to country.
Thank you, Amanda. I'd like to acknowledge the Bunyurong people as the traditional custodians of the land on which we work. We pay respect to elders past and present and to those who continue the journey. We recognise the rich Indigenous heritage and culture of this country. I'd also like to welcome you all today. This is an exciting forum for us who are on the members of the Policy Development Committee. So it's great to see so many faces here, and we all look forward to the conversation today. So feel free to say anything you like about anything to do with policy at COTA, but today is hopefully the first of many of these sessions. So I'll hand back to Amanda. Thank you very much.
Thank you. And we've still got people coming in. Okay, Angela, if it's possible, when we've got the speakers, are you able to see if you can pin the speakers? For those of you who don't know, neither Angela or I are Zoom gurus, so we're just doing our best. So thanks, Greg, for that acknowledgement to country. I'd like to ask everybody to just keep your microphones on mute unless you are a speaker and it's your turn to speak. But we are very interested in your comments and questions, and we greatly encourage you to use the Zoom chat function. Most of you are very familiar with the Zoom room by now, but for those who are not, the chat function is down the bottom of your screen, but I'll get Angela, Joe, my colleague at COTA Victoria, to write a comment into the chat, and then that should appear in your screen and therefore be up on your screen so that you can add any questions or comments to the chat. Okay, so today's session will be split into two sections. The first section will be a conversation with our guest speakers from MS Australia. I will introduce them shortly. Then we will have a 5-minute break, but please come back. Hopefully you won't get too bored because the second session is at the meaty panel discussion with our very own COTA volunteers and policy colleagues who do this work around policy advocacy on behalf of older people for various issues. And we'll hear more information about those issues in that panel discussion. But first, to our guest speakers from MS Australia, who were asked to help us understand how the jigsaw of lived experience and policy development fits together respectfully, authentically, and effectively to create change. Andrew Potter has been in the role of National Advocacy Coordinator with MS Australia since May 2014. He has a long history of advocacy and lobbying and substantial experience in the disability and inspectorial sectors. Having had MS for over 25 years, Andrew maintains he treats it with the respect and contempt it deserves. He believes that in sharing advocates' experiences, the program is a vehicle for positive political and social change. His passions include genealogy and nature. He lives in regional Tasmania with his wife Jane, and they have 2 daughters. Andrew Giles was appointed as National Policy Manager at MS Australia in April 2014. Previously, Andrew spent 25 years in various administrative roles at Deakin University, including as a faculty research administrator, executive officer in the Office of the Vice-Chancellor, and as Director of Community Relations. He has expertise in policy development and systemic advocacy and works with MS Australia's advocacy team to champion issues of in a dynamic policy environment to bring about improvements to the lives of people with MS. So welcome, Andrew and Andrew. Hopefully people will stop popping in shortly and we'll be able to not have those beep. So welcome, Andrew. Now, first, I have to ask, do you have to be named Andrew to work in policy at MS Australia? Andrew Giles?
Yeah, yes, that does definitely help.
And Andrew Potter?
I changed my name. No, I didn't.
Wonderful. Thank you.
Purely by chance.
Great. So the first question's for you, Andrew Giles. Can you tell us a little bit more about MS Australia and what you do? Perhaps you could use a systemic example of your policy work.
Sure. So most of you will be familiar with the multiple sclerosis world and may have come across our fundraising or the MS Readathon. So MS Australia is the national peak body for systemic advocacy and for research in Australia. When I say research, we act as a research broker. So we don't have labs and biomedical labs investigating research, but we obtain grants and we do fundraising through Kiss Goodbye to MS or the May 50K are two big fundraisers we do. And that is to fund research that we broker out then to various health institutes and universities across the country. Systemic advocacy, so if you, as a person living with MS, have a problem with your NDIS plan, we will get somebody from one of the state organisations to help you, who's an expert in the NDIS. But an example of systemic advocacy was a year or more ago when, if you remember, the then Minister, Linda Reynolds, for the NDIS was very keen to introduce independent assessments. And like many other peak bodies, we objected strongly to that because we figured that people with MS didn't need to be independently assessed. They needed to be assessed by their healthcare team. So we joined the sector in objecting to that, and we had a win. So systemic advocacy had a win. Independent assessments were withdrawn as a policy objective of the former government.
Great, thank you. And Andrew Potter, advocacy is often a word bandied around. Can you explain to us what this means? What is advocacy?
As my colleague Andrew has just mentioned, advocacy for us is from a systemic perspective in our organisation. So we act on behalf of our constituents or the people with MS throughout the nation. We don't provide individual advocacy, and Andrew's just mentioned a good example. If someone came to us and said, hey, I've got an issue with my NDIS plan and my local area coordinator, we would link them with someone from the state service so that they could be provided individual advocacy. From our perspective though, we're more system driven, be it Centrelink, be it superannuation, be it aids and appliances, transport, superannuation, tax, relationships, employment. Again, I say employment, that's a biggie for us, given the bulk of our constituents or our folk with MS in the nation, including myself, usually diagnosed between the ages of 20 and 40. So hopefully at the peak of our lives, and employment's a big part of that. So yeah, it's very much systemic, and on behalf of our 25,600 odd identified folk at the moment in the nation that are living with MS.
Yeah, great. So it's big problems that affect people at an individual level that you've both spoken about. Andrew Potter, how do you involve volunteers in this work?
I'll share a bit of my history, which will give you a good perspective, I think, or hopefully a healthy perspective. I've lived with MS for over 32 years, so I cracked 33 years in September. I tried to become involved about 20 odd years ago and give something back, given I'd had some great support from MS TAS as it was then, given I struggled with my health and with MS and so on, as you do. So I thought, oh, well, I'm a good talker, I'm a good doer. I've had some wins. I'll volunteer. So I volunteered in the advocacy space a bit with MS Tasmania. I was then invited to be an advocate, and not long after that became the national coordinator for the program. And we have in the organisation MS Australia, we have about 15 people that are all folk living with MS and or their significant other or partner or spouse is living with MS. And they provide us with the representation from our community that gives us that broad cross-section and dynamic of what it's like and what the issues are for our folk living with MS. It's different for everybody. The journey of MS is different for everybody, so it's very confusing and convoluted. So we need to ensure that we have a broad cross-section of representation so that we don't focus on something like superannuation if it's not necessarily relevant, Centrelink might be more relevant, or employment may be more relevant, or aids and appliances, or a parking permit might be an issue for some of us. So it's broad ranging, but we absolutely engage the national advocates, and we turn those over a little bit, and we have other people that volunteer for us as well, and we use them for vignettes or their stories. And we often find that when we're lobbying or negotiating with Parliament or MPs and senators, that the most memorable occasion for budding or aspiring or existing politicians is someone's lived experience story or their journey. So we use that and we market that. Better us doing the job. It's about us, for us. We'd like to think it's all about us, for us. And we are best at representing ourselves. So if we can support folk to be well equipped to represent themselves with an issue that we might be promoting or marketing or lobbying on, then we use someone with the lived experience. That adds credibility to the issue, and it's a real life example. So whilst it's systemic, we use people that are experiencing the issue to share their journey, share their story, share their frustration or their joy if it's a success. Independent assessments are a good example. I didn't need to be assessed every 3 months to see whether I still had MS, and that was the proposal years ago. And who was going to do it? How much was it going to cost? What were the benefits for me, for the community, for the government, for the nation? So anyway.
It's crazy. And you've already answered my next question, so that's very, very efficient. But I'll flip it and say, what does it mean to you as a person with lived experience to be able to participate in that systemic advocacy or big change? What does it mean to you?
I think first and foremost, and I see this with our team of national advocates, it's empowering. And it provides credibility to, or credence to, us adequately and appropriately representing ourselves with the support from the organisation. And it provides, I suppose, some sense of fair and reasonable or power and control or destiny to us all, but it's an inclusive model, and it provides us with, and it equips us and the advocacy team with all that we need to do to make that positive change, no matter what it is, whether it's something small in someone's life or in a group of our cohorts' lives, or whether it's something substantial. It might be disability support pension for folk, it might be the NDIS. It could be that if you're turning 65 and you haven't got an NDIS package, you need to hurry because you need to have a number before you turn 65, because otherwise after 65 you're part of the My Aged Care team. So yeah.
Yes, we'll get into that later, don't you worry.
I'm sure.
Thank you. So we're interested in both your views on this, but we'll start with you, Andrew Giles, and let Andrew Potter have a break. How do you support and personally walk that fine line between sharing a lived experience or asking someone to share their lived experience and not getting too caught up in your individual experience so that you're representing the collective good or the greater impact of change? How do you help people do that or do it personally?
So we seek views from the MS community in a couple of different ways. So one way is to do a big survey. And last year we ran a big survey for the MS community and we got 3,000 responses, and we asked people to prioritise what they felt were the most important aspects of MS research. Obviously, number one is find a cure, but also aspects of treatment and management of MS. We also ask people to give us feedback on what we should be advocating about in a bit of a ranked order. Is it aged care? Is it health? Is it disability? Is it more MS nurses? Is it better access for people living in rural and regional? So we got that information from a big anonymous survey. We followed that up because at the same time we were doing MS Australia's new strategic plan. Andrew Potter and I ran some focus groups of people with MS. I think we spoke to about 30 people through half a dozen focus groups, and that helped reinforce and tease out a little bit of what the survey results were, so that we had a better understanding. I mean, you all know what it's like when you fill out a survey. Depends on how you feel on the day and what happened that morning and what you had for breakfast and whether the sun's shining. So the focus groups also help us gather information. All the time we're asking people to put their hat on of their own lived experience, but also imagine their peer support group or their MS gym group or other people in the MS community. So we try to get people to think not just about their own, which is with MS, a very individual experience of MS as a disease. We also ask people for vignettes, and Lauren, who's on the call, and Peter, who's on the call, because we're all involved in the Assistive Technology for All Alliance, know how hard it is to get stories from people that are really helpful in pushing your message forward. So, as Andrea said, where we can, we're meeting with polys. We'll make sure that people with MS come with us, are in the room. So that's one thing. We haven't had much success with templates. So we try as best we can to find people who are happy to share their story, and then perhaps write the story up and send it back, and we go to and fro until we've got that neat 200 or 300 words of that story about the topic.
Yep.
So if we're talking about a new drug going on the pharmaceutical benefits scheme, we want to hear about how this might help you stay at work or maintain quality of life. We probably don't necessarily want to hear too much about your problems with the NDIS, a little bit, but you have to sort of focus on what the issue is, and to and fro with the person to make sure that you've got their story right and their permission to use it in that way.
Yeah.
Usually we de-identify the stories too. That makes people a bit more comfortable.
Yep. Okay.
A lot of people not so happy to give you a story if they think it's going to go into an NDIS report, and they're going to then be targeted by someone in the public service to have their package reduced. There's a bit of fear about that, and we have to be very cognizant of that when we're getting people's stories.
Yeah, good point, protecting people's rights. Andrew Potter, how do you walk that fine line between not getting caught up, or when, you know, in your own experience, lived experience, and presenting the collective views?
It's always a challenge, and just listening to Andrew Giles' chat, I recall an experience from 12 months ago when it was Continence Week, and there was a call out for a story, a vignette on continence. I was targeted to share my story in relation to that, so I was in a conundrum of what do I say, how much do I say, what's the perspective going to be? I'm challenged with continence, no question. It's a public thing. It's on our webpage, the whole thing. I was interviewed by the Bridge magazine, which is part of the Continence Foundation of Australia, and there was a big spread in there of the challenges that I face in relation to continence. But it was generic. It wasn't just about Andrew Potter. It was about the cohort of people with MS in the nation, that some of us struggle with continence. So it was focused very, very definitely on issues in relation to continence management, opportunities, aids and appliances, equipment, supplies, etc. So that was one example that I was challenged by, given I'm here to spruik and support other folk in my role to obtain a vignette or whatever we're after. But it was a good story, and it went nationwide. It was quite good, so everyone in the world knows about my continence. But the message that I got out and my theme for that particular article was it touches all of us one way or another in the MS community as far as our challenges with continence. Not all of us, but most of us. But it's different for men too. So as part of that, men are 25% of the cohort in the nation, in the world with MS. So I was happy to be overt about sharing my journey to represent the cohort. So hopefully that answers your question, Amanda.
Yeah, it actually answers the challenge one as well. So that's great. Thank you. Thanks, Andrew. And it's really great to hear the courage that you show in your role that you have. So for both of you, how do you know when you get it right? When you get that lived experience to the collective view and the policy pitch to the pollies or to the media or to the whatever, you're trying to change minds and get support. Just briefly, because we want to get to any questions from the audience. So how do you know if you've got it right? Andrew Potter?
One example I can use, and I used it in the meeting earlier this morning, part of my role is to lobby politicians on particular issues that we might be spruiking at one time or another. We love them all, metaphorically, left, right, independent, teal, green, whatever. I have an interesting experience here where I live in the northwest coast of Tasmania, and one of our senators happens to be Jackie Lambie. She's been tremendously supportive, love, loathe, whatever, it doesn't matter. As I said, we love them all. They're here to serve us. Her most recent, given the most recent election, she now has someone else that's also a senator in Tasmania as part of the Jackie Lambie network, and that lady is Tammy Tyrrell. Purely by chance, 100 years ago, I worked for another organisation, local government organisation, that Tammy used to work for. She knows me a little bit, but I spoke that when I was getting petrol a few weeks ago, when she was advertising herself. So that, for me, provided the opportunity to share my story again, remind her, linked it in with the Jackie Lambie network through our email presence, and they know our story, they know our issues, and if we needed her or them both to spruik us, they would. Similarly with Andrew Wilkie, we've got good relationships with Andrew Wilkie and with a broad range of other politicians, but it's a slow burn. And we've had to be smart and slick about it, and it's repetitive, and then they change and we do it again. But if we've got our story right, we've got our documentation, we've got our vignettes ready, and we've got our people ready, and we know what we're doing, and we're of today with issues that might be in our world. For us, we don't always get the answers, and we don't always achieve what we set out to achieve. But if we get the message right, then we've done ethically the right thing by our community.
And your questions and your asks aren't changing all that much.
No.
Andrew Giles, how do you know when you get it right?
Well, with it, if it's the media, you know, because you've got one of your people on the couch on ABC Breakfast on World MS Day. And we did this year with Astrid Edwards. She was there with Michael Roll. No, it wasn't Michael, I think. I think he was away. But anyway, you get the person to make an appearance or you get published in the media. So, and often our issues are not actually news. They're more special interest stories or more issue focused. So that is hard work to get stuff published, op-ed pieces and things. You get invited to make submissions or appear before Senate inquiries because you've written good submissions in the past that include lots of lived experience material, stories from people, results from surveys, you know your numbers, you know you've got your information ready, you write short, sharp, pithy submissions that chairs of committees find helpful. So always seeking to align yourself. So at the moment, we're having a good look at what the Labor and Greens, Labor can't get any legislation through the Senate now without Greens. So having a really good look at what Labor promised for disability and health and aged care in the election, having a good look at what the Greens platform is. The great thing is both the Greens and Labor are very interested in the patient, as they call it. We would call it people with lived experience. They're very interested in that voice compared to the previous government.
Well, so it's a real shift anyway, isn't it?
It is a real shift and a real opportunity. So if you get to brush up with Senator Steele John from the Greens, although he's over in WA, you know, what they're interested in, you know, they see access to healthcare, access to aged care services as a human right. So that might colour your messaging, might colour your approach to any Greens or Labor local members that you have. If you start changing your language to human rights, to access to the patient voice, you'll probably get a good hearing.
Mm.
And if you get invited back, then you know you've got it right. If you get invited, instead of you knocking on the door all the time, if they ask you, and sometimes that's why alliances are good. If you can buddy up with other people, they might say, oh, we now want to hear from, I don't know, the Neurological Alliance or the Assistive Technology for All Alliance that Lauren and Peter and I are involved in. So that's another way of saying, well, I don't just coming from me, I represent, 100,000 people or 1 million people, but always be, pleasant, polite, helpful. Is there something I'm doing that can help you? How can I help you get that issue over the line?
And of course, you're doing all their homework for them anyway.
Make it really easy. Make it really easy for them. But you will notice if you go into a room with politicians these days, they will come straight up to you.
Yeah.
They don't want to talk to me really or my CEO. They want to talk to Andrew Potter.
Oh, sorry, Andrew Giles.
So, but that's good because
It's a suit.
I just hide down like that behind Andrew Potter and let him do the talking. So, but folks like you who are on the call today, you need to get from your organisation material that makes you feel confident and comfortable, whether it's the one-page fact sheet or a briefing note or something, so that you feel comfortable in speaking about your lived experience and with your people. You feel I've got a really good, and you feel very confident. That's really important because you don't get much time with some of the decision makers.
You've got to be on point.
Yeah,
writing the elevator pitch, don't you?
Yeah, same with your written submissions. It has to be short and pithy, and any training you can do or advice that you can get on short, sharp stories, that's the thing. People's attention spans have reduced since I was at school, and it's all about short, sharp messages and having some numbers. Probably we don't have to worry so much now about economic rationalism. We don't necessarily have to always say now how much something costs. We used to, but now more interested in how does this impact on your quality of life. That will be, I think, with Labor and Greens, they'll be more interested in that. Fingers crossed.
Yeah, it's nice that it's turned around to how you get to participate in the world as a human. So Andrew Potter, what advice, we have got a couple of questions, so I'll go to the chat in a moment. But Andrew Potter, what advice would you give to the staff here who are seeking to put input lived experiences into their submissions or their media work or their pitch for funding from the various bodies?
First and foremost, respect. Absolutely. Respect for the individual. Do your research in relation to the subject matter that you might be spruiking. I seem to have used that phrase a lot today. Ensure that you're well informed and you're aware of, if you're using somebody's story, that they are absolutely A-OK with that story to be shared. And you need to go over and over and over for consent to ensure that it's A-OK for people to be broadcast, because it's not, on one hand, it may be okay to hypothesise about it, but to actually do it and for it to be on Facebook or in the media or in the press or on socials, that's a really big deal, because you're putting yourself out into the big world. And that, for some people, is just too hard. And that's why I'm okay with doing it. I'm dented enough, been around enough to get over it. But that's me. And the person next to me may not have that capacity or that confidence or that desire. And that's okay. So do your research, have accurate information about the subject matter that you're talking with the constituent or the individual about, so that you're not going off half-informed or ill-informed, and you don't want to cock it up, to be honest. You need to get it right, but it has to be absolutely respectful to the individual. One other thing I would have to say is that politicians love having their photos taken. So if you're navigating and negotiating with politicians and you're wanting to get into the groove with them, just take a snap with your phone with them, with the person with lived experience. Politicians love having their photos taken. They don't need to do anything so much. But if you take their photo, they feel empowered and included. It's a positive stroke for the politician. We then will put it up on our socials if we can, or send it back to them saying, thank you very much. And it keeps that link of conversation going. And that's one of the take-homes that we have for people always, particularly with our advocates when they're meeting with politicians. Get the photo taken, give them a document of your key message that you're after, and that's their take-home, either the politician or the chief of staff or their advisors, so that they know exactly what you're after. Don't leave it and say, I'll email it to you. You need to have the documentation there, short, sharp and succinct, as Andrew Giles has said, and that gives you the follow-up capacity along with the photo. And if I'm going into someone cold, I check when their birthday is. And it's purely egocentric, but if I'm introduced to a politician, I'll go, happy birthday for last Monday, got them straight away.
Unless it was 6 months ago.
Oh, no, I can talk about that, or a commonality. I mean, there was someone I met a couple of years ago whose birthday was on the same day as my mother's, and it was 6 months ago or something, and I used that. I said, 7 February. So there you go, 7 February, my mother's birthday.
Nice to find a point.
It's a soft point of introduction to them. So.
Thanks. I think the only other thing is that with working with people with lived experience, in what I've found is that you've got to follow up as well with the person. If you're the staff member or if you're a volunteer doing that work, you have to call them afterwards and do the debrief and say, how is that for you? And, you know, depending on the circumstances around what you're talking about, it can be quite triggering. So we really need to ensure that people are being well cared for and well supported, and they're not just a short, sharp story to us. That's for sure.
They don't need to be used. They need to be valued and supported, and coached and mentored into that. And that's part of the package. So keep it all sweet for everybody.
So we might go to some questions in the chat. Lucy's asked, she'd love to hear how to get people to complete surveys and what percentage of those, when you're doing them for MS Australia, get completed. Do you find online or paper or both easier? How do you get the buy-in? Andrew Giles.
It's a great question, Lucy. I sometimes feel that the MS community are the most surveyed people in Australia because 25,600 of them, I think it's probably closer to just over 30,000, because those numbers were calculated in 2017, so they're a bit old. We try as best we can when we ask, the people that we ask to complete the surveys come from existing lists of people. We get our state MS organisations to help us, so that we've kind of got we also put a call out generally on our social media channels in case there's someone we've missed, but we try to make it very clear what the survey is for and how it's going to help us, and then maintain the database and then follow it up, as Amanda has said, with feeding back, well, thanks for your input into our strat plan. Here's the strat plan, and we hope that you can see where your comments were used. So you've got to go back to people all the time. There are a group of people in the MS community that have signed up to the Australian Multiple Sclerosis Longitudinal Study, and there's a few thousand people in that. Big asset for MS, because those people have signed up to be surveyed regularly, a couple of times a year after year, and this year it's celebrating its 20th year. So there aren't too many other big disease groups that have had a big cohort of people that have signed up to be guinea pigs via survey for 20 years. And the longitudinal data that comes from that is just so valuable, particularly for our researchers, how various treatments are going, exposure to sunlight and vitamin D, all the things that are somehow connected to MS. So it's online, obviously, is the way of the world now, but I think in the last survey we did make paper versions available. There's a lot more work, obviously, in compiling the results from paper-based. So where possible, online, but we're aware that a lot of people in our community are not online or have got functional impairment such that using a keyboard and responding to a survey is difficult. So, and it's making the case, why should I fill this survey out, trying to convince people that it's going to help them in the future. Better treatments, better management, maybe one day a cure.
Yeah, a purpose. Yeah, thanks, Andrew. And you've already answered Lorraine's question about membership.
Yeah.
But, so thanks, Lorraine, for that question. It's a federated model, which is, but state-based membership, which is very similar to COTA Victoria and the other COTAs. And then there's another question for you, Andrew Giles, from Peter Wilcox, your colleague in AFTA, of course.
Yeah.
We are going to talk about AFTA in the panel discussion, but if you could just briefly tell us about the experience of working with other peaks, because I think the Alliance is up to more than 60 different groups, isn't it?
Yeah, so MS Australia has taken a view. I hope it's a shared view with my colleagues. It makes me wonder sometimes, but we feel we can't, as MS, we can't do everything: aged care, healthcare, disability care, employment, housing, transport. You can't do everything on your own. And years ago, I don't know, Peter, you might have even been there. We were at one of those awful NDIS seminars where they were trying to roll it out and trying to make it up as they went along. What did Joe Hockey used to say? We're building the NDIS as we're flying the plane or something. Anyway, we were all asked what our top issue was. And I said, when it was my turn, my top issue is what happens to everybody outside the NDIS? What happens to their needs? And during the tea break, a whole bunch of us all gathered and swapped business cards and said, we've got to do something. That was one of the genesis of ATFA. It's buddying up. We're also in the Neurological Alliance. We're in the Accessible Product Design Alliance. We're in all sorts of alliances and partnerships because we've got common views and common purposes. We can all help write submissions. We can all provide delegates to go and visit. We can make ourselves available, as we did this week, to the Department of Health for a consult. So alliances and partnerships is a really great way to do advocacy. It's great, but you've got to be people of goodwill, make partnerships and alliances. So that's your starting point.
Yeah,
you want to do something, and you've got to have goodwill.
Yeah, thank you. We're just about to head into a break, but there is a final question. Could Andrew Giles, thank you, Carol, for the question. Could Andrew Giles briefly describe the link between MS and exposure to sunlight and vitamin D?
Well, not being a researcher or a clinician, the further you live away from the equator, the higher the risk of multiple sclerosis. So there is something, Andrew Potter will jump in because he lives in Tassie, which has the highest prevalence of MS in Australia compared to North Queensland. There is some link genetically, possibly, between exposure to vitamin D and MS. It's a risk factor. So the further you live away from the equator, the more chance you have. So much higher prevalence in Scotland than in Spain, for example.
Yeah. Okay.
That link is not, I can't point you to a study that proves the link, but it's being thoroughly investigated as we speak.
Andrew Potter, have you got anything to add?
Only that I have my vitamin D levels checked every time I have a blood test. And that happened earlier this week because I see my neurologist in a week's time. 6 times more likely to have MS if you're born and grew up in Tasmania than if I were born and grew up in North Queensland. If my heritage is of Anglo-Saxon or from countries closer to or further away, from the equator, then more likelihood with MS. As I've shared already, 75% of our cohort are women, 25% are men. There's some genetic link sometimes, but it's rare, it's unusual, and that's being studied. Vitamin D is being studied by a range of universities internationally as well. So it's a contributing factor. It's interesting, my vitamin D level, I'm a bit different, as most of us with MS are. My vitamin D levels are fine. I've got everything else that goes with MS, but vitamin D levels are fine. Yet my wife, who grew up in North Queensland, has low vitamin D levels, probably because we've been in Tasmania for 25 years. It's a challenge, but research is there, and vitamin D is but one of the many
Great
things that are being researched.
Oh, thank you. I wish we were finishing on a high note, but anyway, it's good that it's being researched. And Helen Wilson, who is part of our policy development committee, has added a link into the chat about some research in that space, which might help you, Carol, with your desire for more information, and anyone else. So thank you, Andrew and Andrew. You're not brothers, are you? The Andrew brothers? Ha, ha, ha. No, sorry, I was just joking.
We're brothers in arms.
Yes, brothers in arms.
I did say at a presentation we gave a couple of weeks ago, here's B1, I'm B2. And it's a bit...
Well, because we're both A names, I feel like we're the triple A's. So
that's it.
Yeah, we're in.
Best credit rating you can have, triple A.
So thank you both for your time and your insight. You are most welcome to stay for the second part of the session and the panel discussion. But for everybody, we will unpin you, of course, to the... but for everybody else, we're going to have a break. My clock says 2:44. So we're going to have a break for 5 minutes and come back for the panel discussion. So I'll just put that time in, and we'll see you all in 5 minutes. Just feel free to turn your cameras off or leave them on. It doesn't really matter. So we'll come back at, it'll be 2:50. $2:50 on my clock, but my computer is 5 minutes behind, so that makes it interesting. We'll just wait for a few more cameras to turn back on. Hope you all had the chance to have a stretch, bit of movement. We sit in front of a Zoom room computer too often, too long. Next time it might have to be 10 minutes so we can all go out and get our vitamin D.
Just where I've been.
Very good. All right. Okay. So, Angela, are you able to pin the panel speakers up? Do you know how to do that?
I think I've got most people. Let me just go through and make sure we've included
Okay,
everyone.
I'll be introducing them anyway. So I'll go ahead and introduce people, and then you'll know who to pin. And if not, I can do it as when we start talking. Okay, so welcome back, everybody. Now, I'd like to acknowledge my colleague, Lauren Henley, who was going to run this part of the session. Unfortunately, Lauren's not feeling quite so well. She's here, though, I think. Lauren, are you still here? Let me just check the second screen. Yes, she is. So I'm hoping... Thanks, Lauren. Lauren, we had a glitch with the animation, so I will call on you when we get to the after part of the panel to describe what the campaign is. So, but to begin with, let's introduce the rest of our panel speakers. So our panelists today, not in any order of importance because we're all equal at COTA. So Alexia Huxley is the COTA Victoria manager, my boss, of policy and advocacy. She previously worked in Seniors Rights Victoria, supporting the Elder Abuse Prevention Networks, and at Oxfam Australia as the Director of International Programs. Alexia has a Bachelor of Arts, Bachelor of Social Administration, Masters in International Development, Graduate Certificate in Ageing, and has completed the Understanding Dementia MOOC. Greg Nichols is currently President of COTA Victoria, Chair of the Policy Development Committee, and a member of the COTA Australia Board. He has extensive experience in the health, aged care and community services sectors in South Australia, New South Wales and Victoria, and most recently was CEO of a large community health service. Rhonda Day is a member of the COTA Victoria Policy Development Committee. Rhonda has a Master's in Public Policy and Training in, Rhonda has a master's in public policy and training in dispute resolution and mediation. She worked in a number of senior roles, including Assistant Ombudsman in the Victorian Ombudsman's Office. Rhonda represents COTA on the Melbourne Ageing Research Collaboration, which is MARC, which conducts research on health and ageing, and she chairs the Community Advisory Group to provide a community voice in research. Peter Wilcox is also a member of COTA Victoria's Policy Development Committee. Peter is a passionate disability and aged care advocate for independent living and the provision of quality and appropriate assistive technology. He has been instrumental in the work that COTA Victoria has led nationally in the assistive technology space. But he also sits on the federal government's advisory committee on the reform of the in-home care aged care assessment tool. Anita Smith has been an active COTA Policy Advocate volunteer since 2015. In conjunction with another volunteer, Anita conceived, gained funding and completed the COTA project Death of a Partner, which led to national policy change. More recently, Anita has been involved in many Zoom room advocacy consultations, including pricing consultations for water corporations, payment difficulty framework for essential services, healthy ageing research, energy consumer insights, digital divide forums, older people returning to community life in COVID normal, and a discussion with the Transport Minister's advisor, just to name a few. And last but not least at all is Ruth Hosking, OAM. Ruth is a dedicated volunteer for more than 60 years in her regional community of Bendigo and statewide for COTA Victoria. Ruth's love of volunteering runs deep, and she is driven by a commitment to helping people to help themselves. At COTA Victoria, she is part of the Education Peer Support Group, many of whom are present with us today, as well as supporting the Aged Care Navigator program and participating in many panel discussions and focus groups for the policy team. So welcome, panellists, and thank you for your time. And just some explanations for some of this work before we get going. The Aged Care Navigators program, which is what Ruth participates in, is part of a national trial led by COTA Australia and other organisations. This program provides free, independent and confidential information to older people, their families and carers about the various aspects of aged care services at home. The service can be delivered by phone, email or in-person conversations and enables information to be given to personalise the replies that relate to the caller or consumer's circumstances and the support that they already have in place. So for Ruth, who lives in a regional area, she can add the comment and advice based on that regional perspective or whatever the consumer's needs might be. And what is MARC? MARC is the Melbourne Ageing Research Collaboration. It's a branch of the National Ageing Research Institute, or NARI. Its members come from health, research, aged care and advocacy organisations, including COTA, who work together to promote and conduct research to improve the lives of older people. And our representative on that is Rhonda. So I might just pin the people that are going to participate on the thing, if I can get to them. Add pin. Peter Wilcox. I'm not sure whether it didn't work because I'm host and Angela's co-host. And Ruth, add pin. Is that everybody now? Have I missed anybody out? Yell out if you're meant to be. Sorry, trying to do all the bits and pieces. That's right. Okay, so here we are. So we thought it would be more interesting and interactive to have a panel discussion rather than just say, this is our policy on aged care or this is our policy on blah, blah. But we've got a lot of topics to cover and we've only got an hour, which is quite a short period of time to give everybody an amount of time to speak. So this is acknowledging that because of the time constraints, this will be policy in bite-sized chunks. Hopefully we can expand on the discussions in the various topic areas in greater detail at a future time when we get to meet in person. So I'd like to ask all of the panelists to keep their answers brief, and I know that's really challenging. So Anita, we're going to start with you and the digital divide. Can you briefly explain what the term digital divide means to you, and how does this issue affect older Victorians?
Most of my work with COTA comes under what I call my heading, the presumption of understanding. For me, digital divide is that many older people have digital devices, but they struggle to comply with demands of governments, private companies and healthcare providers. As everyone presumes that people have updated devices like smartphones, they have scanners, printers, and they can use all of these things. That means that it's a major barrier for a lot of older people to be able to assist and services and things. Even if older people are computer literate, it still can be a struggle to comply. You're very lucky I'm here today because coming back from overseas, I had to complete the Australian re-entry digital form 5 times, which didn't work. So I'm lucky I'm here in Australia. With COTA, I've helped work on the COTA's policy position for digital. And it says that older Victorians must not be required to engage with digital technology in order to access the information services they need. There must continue to be a range of low-tech solutions available to ensure all older Victorians have simplified, independent and timely access to the information services they need. Older Victorians must be provided with opportunities to gain the maximum benefit from digital technology if they wish to do so. This means ensuring older people have affordable access to high quality internet, own a device that will enable them to use the internet, are able to use the internet in an accessible way, whether they have a disability, are from a culturally or linguistically diverse background, or have other needs. Have the skills to engage with digital platforms such as online banking, MyGov, telehealth, and social media. Have the confidence to use the internet safely.
Yeah, thanks, Anita. And yeah, we have heard from many of our peer educators and other volunteers about some of the challenges with digital technology, including, doctors that want to do a skin check via Zoom, and things like that, which is like, really? So Ruth, I might ask you, you're living regionally, quite a hike when you needed to get to Melbourne to attend meetings. How have you found the increased use of technology during the pandemic, even though we know that you don't mind getting up early?
Thank you, Amanda. I believe if I had had the knowledge and the opportunity to use Zoom and Teams and meetings, I would have gone balmy over the 2 years of lockdown, because it enabled me to keep in touch with you all and still work locally with people because of having that piece of knowledge. And it's most unfortunate for those that didn't learn it younger, and that to me is the secret. I had to learn it or leave work, learn computer, and I'm just so grateful that I did it then, and make mistakes now, but it's just been a godsend. And I use the telehealth component for my husband to have contact with his doctor and specialists, and that's been a great boom too. Yeah,
great, that's good, and saves a trip, to go and see those specialists.
Oh, and I'm also on a subcommittee that Murray Primary Health Network is looking at the use of telehealth in residential care facilities.
Oh, okay. Well, let's hope they don't replace it completely, that we still have humans going and visiting people in aged care. Yeah. Thanks, Ruth. And, just for everybody's information, because, there's a presumption that it's hard for older people to use technology. But how old are you? And you're using technology.
How am I?
Yeah.
Well, I'm the same age as the ABC, which is celebrating its birthday. next week. And I don't like that. I'm not that age. Theoretically, I am, but not in practice.
Right. Yeah, great. Well, that's a wonderful age to be for both you and the ABC. So thanks for that. And we've got a question around this topic. Just a general, a comment, Lorraine. We do have a class structure, and this impacts on access to technology, understanding the funds to utilise current technology. That's right, Lorraine, and Anita touched on that we find with many of our volunteers that it depends on, your living circumstances, your socioeconomic stance, and sometimes just geography around, whether you have, how you are impacted in how you can use technology. So is there any other questions that people want to pose? No, we've got a lot to get through, so don't worry. I'm going to bring the other panelists.
Amanda?
Yes, Winnie.
Just a question for me. How can we better support those people, regardless of age, because with accessing technology, and particularly supporting people with getting over the fear of being part of technical age. I now work with so many people that don't have a smartphone, don't have an email address, and they're not in their 80s. They can also be in their 50s or 60s. It's not age related, I don't think. What can we do? Because so many services are now reliant on it. It means that people can't access, QR codes, MyGov, services, so many things. People are being left behind.
Ruth, have you got any comment you'd like to make? And then I might throw to Alexia, because we're looking at doing a project in this space.
Nice. I think I was very fortunate that my grandson used to come when he was attending secondary college, visited every week, and each week he would give me a lesson on using the computer and updating. And that's the basis of how I learned to do this. And I really feel for the people that haven't learned, but it's just so important that we have the ordinary telephone, because that's what so many of us grew up with, and that'll have to stay in for another generation at least. We mustn't just assume that everyone's got the internet, which goes down, absolutely. I mean, it's not infallible.
No.
And it's just, I've had advantages that perhaps not everyone has had, and it was, we didn't know that we were going to have COVID.
Yeah. Thanks, Ruth. And we're glad you did have that advantage. Anita, I know that you've supported a lot of people in your community with their digital access.
And that's one of the problems with COVID, is that many people relied on family members and friends to be able to do the digital technology for them. And during COVID, that hasn't happened. So a lot of people are really behind on their understanding or being able to do things. And there is probably need to say to government, all range of organisations, not everyone can do. And that partly answers the question before, that there needs to be alternative for people.
Absolutely.
Not this presumption that people can do it.
Yeah, and that's a
good devices.
Thanks, Anita. That's a great segue for Alexia. Would you like to touch on what the digital project that we're proposing to do, and not that it's formalised yet?
Yeah, so just to put it in context, there was money in this year's Victorian budget to support greater connectivity for older people, and there will be a government project around that. And there are obviously issues in that around the cost of connectivity, like, having the right device, being able to afford the internet. But there's also the kind of training issue and the helping people get over what Wenny was talking about in terms of feeling that, you're not going to break something by having a go at this. It's, people can experiment with, using computers, etc., which I think is one of the things that for people is often an obstacle, is they think, I don't know about this, but everybody else does. And we have to help people get over that. But there are some people who are never going to be digitally connected. It may be because, you know, they have something like arthritis that makes it hard to use the keyboard, or they have come, you know, they have come from another country, from a cold background. They may have limited literacy, not only in English, but in whatever their first language was, and not feel comfortable, don't want to find. There are some people just not interested.
That's right.
We need to hold governments and government departments to account to provide the same services for those people. And that's probably the area that we're interested in exploring, because that's not where the government's putting its energy at the moment. And yet we have to ensure that's the case. I mean, you look at things, I looked at the heating and cooling concession in Victoria recently. All the information's online, how to apply for it's all online. This is quite a substantial amount of money. It's $1,000 you can get towards improving your heating and cooling. And if you don't have the necessary connectivity already, you won't be able to do that. So we have to be working with different service providers, not just governments, but other organisations as well, on how to ensure that. And I think what Ruth said about, you know, the telephone is still relevant. The landline for many people is still relevant as well. And that for some people, letters are still important as well. So
Yeah.
we've got to continue to push that line as well.
Thanks, Alexia. And there's been some great comments in the chat that that support what we're all saying and expressing the fear. So we, running a little bit of over time. Angela has messaged me, so we'll move on to aged care. Sorry, Peter, if you could put your question in the chat perhaps, and we'll hopefully come to it at the end or at the next break. So moving on to aged care, which still relates to digital technology, don't you worry. Aged care reform is a big topic area that COTA has been involved with. So Ruth, coming back to you, what are some of the lessons you've learned from your involvement with the Aged Care Navigator program that can inform what's happening in this space?
So many people are keen to register with My Aged Care, but they don't know what to say. So you need to start from the word go and encourage them to register their representative and how to do it, and then ring back in a few weeks' time to see how they progressed with that step, and to also have ready what I term a shopping list of their circumstances. Yep. You're not only looking at your disease processes, but you're looking at, do you have steps or a ramp? Is your bathroom suitable? There are many issues in the circumstances of each household, and people need to understand that they're all relevant. A friend visited here one day and she had support gloves on, and I said, because she hopped up to make a cup of tea, and I said, what are they on for? And she said, I'm losing strength in my hands. And I said, well, when you talk to My Aged Care, report that. And she said, I never thought about what I'm losing.
Or what you could gain if you had the support,
yes. And to have the support early so that corrections can be made and life enhanced by stepping in before it gets untreatable.
Yeah, thanks, Ruth. And I guess it's making that point that everybody's circumstance in this space is different. So I might say
absolutely.
Yeah.
Because we've all got different supports, we've all got different backgrounds. So many people think that if they ring My Aged Care, they'll be going into residential care. Well, for goodness sake, that's the last step.
Hopefully, yes.
And may not happen. I mean, it can't happen because there's not room for everyone.
Yes, definitely. Some good points. Thanks, Ruth. Peter, we might come to you now. You've been involved in the testing of the assessment tool for the new Support at Home program, which is one of the government's approaches. You've got a couple of concerns, or would you like to? I mean, I know you're sworn to secrecy, so you can't share too much information, but Is there a homogenous approach to this, or is it going to be a great reform for us all?
Don't tell anyone there's a new government. All of the work that's been done to date will be modified and changed. At this stage, the department hasn't completed the conversations with the government, so we really don't know what the new model is going to look like. But I can tell you that as a part of the assessment process, assistive technology and home modifications are going to be a part of that assessment. And that's a big step forward from what it was before, because at least it's being recognised that people's physical needs will be looked at separately from their care needs. It will be a separate program. It'll be separate to the support at home, which is directed mainly at care. Assistive technology will be one model, and there'll be another separate model on the side of that for home modifications. So that's a vast improvement over what's been taking place in the past. My concerns are that we've developed a very expensive system in the NDIS and in my aged care. And a part of that big cost that really needs to be addressed is that we have engaged as what I would call labour hire firms, some call them service providers, to provide the services. And that's made it a very expensive model indeed. Everybody in the process gets a chance to, as a service provider, justify whether something really fits to a list or doesn't fit to a list. And that really needs to be looked at, and the department is well aware of it. I expect that the role of service providers will change in the future. I expect that when there is an assessment for a piece of equipment, that may not involve a service provider. When a recommendation is made for a particular type of service, it may not necessarily go through a service provider. And they're particularly looking at that for allied health. So this should reduce some of the costs enormously. The other thing with our current model, it's very wasteful. People get a total package of whatever at 52,000 at the top of it. They use a lot of that money reserving it for future need and saving for equipment and all of that. That money will go back into the system again. And I think at the lower level, we're really going to have to look at what services we're providing and how we're doing it. There is consideration being given, for example, for home maintenance to not involve the service provider, that you'll go direct to, Gardens or Us or whatever you want to call them, and they will have your registration number and they'll be paid directly from the Department of Health. So there'll be no interim, or my aged care, there'll be no interims in there. So a lot is being looked at, and I expect that a lot of conversations are looking very positive. So I think that the new model is going to look better.
Yeah, great. Thanks, Peter. Ruth, you've got something to add?
Well, Amanda, I serve on that subcommittee too.
Oh, fantastic.
And I'm very concerned the direction that the home care package went in and the number of providers that are out in the community, because I think providers set up and thinking, here's wacko, here's a way of earning some money, and admittedly we've had COVID and the providers haven't been able to function as they would have liked, but there are just too many providers out there, and people are ringing me to ask for advice on how to choose a provider because of, and there are so many people in the community who don't realise that providers are either government-owned, not-for-profit, or for-profit. And that's the component that really concerns me, because once you explain that, people think more seriously about who they're approaching. Because I believe in my role, I have to be non-provider aligned, and non-political party aligned, because I must be independent. And I just give people a list of government and not-for-profit owned providers that are in the district for them to make contact with and
make up their own
decide.
mind.
Yes, and make an informed decision.
Yeah, thanks, Ruth. I might bring Rhonda in at this stage, and I must apologise because I did not pin you to the panel, and now you're pinned, so my apologies. If you could unmute yourself. You're involved with MARC, that Melbourne Ageing Research Centre that we mentioned before, and there's a lot of connections with aged care. Are there particular research topics that are connected with aged care that MARC's been focusing on in the past year? Because it's important to have the aspect of research when we're considering policy development, isn't it?
Yeah, I'll just begin by saying the collaboration is between hospitals, universities, aged care providers and advocacy organisations like COTA and Dementia Australia. We've got Helen Rawson here today, who's on the MARC steering committee, which decides the projects and organises the participation in them. And we've got Lorraine Harrison here, who's on the community advisory group, which I chair, which has 10 people now on it. And I've just picked 3 research topics that I think might resonate with COTA members. One is IMPART, which is improving palliative care in residential aged care through telehealth. This involves supporting GPs, senior residential aged care nurses and clinical coordinators in their discussions with residents and families to improve the end-of-life care in residential aged care and to reduce avoidable hospital transfers. So that's one. Another one is called Short and Sweet, which is developing and trialling Microsoft Learning for community home aged care workers. So some of the topics that they may need to learn, which they don't really have time for to learn, they may be able to do on these short programs. And the other one, which relates to all of us as we get older, sadly, is grief in older people, including the effect of grief on health and well-being and the role of GPs in helping people to manage this. And this project was completed in 2021, but is being extended because it's had it's been really well received. And it's been also taken into the arts area with poetry by people who've been affected by grief, which is now going to be performed at La Mama Community Theatre.
Wow.
So it's a terrific innovation, I think, to get the message across to people. So
that's great. Yeah, great. Thanks, Rhonda. All of those sound really interesting, and it's great to know that there's research being done in that space. How important is it to have people with lived experience involved in those research projects? You spoke about the consumer group that you chair.
Right. Look, community members, as you've been saying all the way along, bring lived experience as members of families with health issues, as carers of people with health issues, as people who've gone through the health and the aged care system themselves. Their perspective will often be different from the researcher's perspective. We've certainly found that.
Absolutely.
And they can ensure research is relevant to the priorities of older persons and in language that we can all understand. And that's been something we've worked quite hard at. There's loads of research to show that consumer and community involvement adds to the value of research. And there's a quote that I always use when I present on this, which is, and it comes back again to the human rights issues that have been raised. I refer you to the World Health Organization and United Nations Children's Fund Declaration of Alma Mater, which states, the people have the right and duty to participate individually and collectively in the planning and implementation of their healthcare.
Definitely.
Absolutely.
Thanks, Rhonda. We've got a question from Helen, and thanks everybody for the comments in the chat as well. Helen?
It's not a question, it was just a comment. Thank you so much indeed, Rhonda, for that presentation. And always, every time we remark, we actually really thank Rhonda and Anne on behalf of, to take that back to the Community Advisory Group, because as a researcher myself, having, we use the word consumers, but we mean people with lived experience, whether your experience is as a carer, an informal carer, or someone who is having to access some sort of care pathway. That is really important, because sometimes you can do a great piece of research, but if it's not relevant or has any bearing on those who you're hoping to benefit from that research, whether you call them the end users, if it's something people are going to use, it's almost pointless, because you've just done a great piece of work. That's a great piece of work with no relevance. It will not make an impact on people's lives or practice.
Can I just add one more thing?
Of
that
course.
The other thing that I think distinguishes a lot of the MARC research is that it concentrates on translating it into practice. So we have things like research on how, for example, you can prevent falls in hospitals, or research on how you can make an emergency department much more friendly for people with dementia. Now, I think Helen did a wonderful piece of research on the access to carers during COVID, to aged care facilities. So
great. It's good to know that. I just, we're always in awe of the work that you all do, especially as volunteers. And Lorraine's made a comment in the chat that CAG has mentioned, regularly mentions ageism as one of the overall blanket challenges. I'd like to also acknowledge Peter's comment that he didn't, and question that he didn't get to say in terms of the digital area, and that is the call for younger people to, or just people, I guess, to help support and nurse the people with an attitude of not wanting to use IT devices at all. But I guess there's always that element of people that don't want to, and there needs to be an alternative for them. So I'm going to move on to transport now, because we're quickly running out of time and we've still got a couple of topics to go. Peter, you've been involved in several different projects at COTA Victoria, some of which relate to transport. What would you say are the three most pressing needs for older people in Victoria in the area of transport?
Oh, look, it's safe, it's feeling safe and being safe, and it always has been. And the thing that amazes me is you ask blokes about these things. We don't feel threatened. We don't understand the need. But I can give you an example of a marvellous success story. I remember the old Spencer Street railway station where the catacombs you used to go through and the cold, wet tiles. You used to feel threatened. You'd come to an end and there was wet steps, and it was just an awful place to be. A lot of my friends back then, they would walk to Flinders Street Station to avoid it. It was just threatening for young girls and women. We've fixed that. We've opened it up. We've made it a space that's enjoyable. We've made a space that good architecture has brought about change. I'm not a great supporter of Uber, but because workers don't get paid appropriately and there's no job security and all that sort of stuff. But isn't it wonderful? You're travelling home on the train, you can dial up your local Uber thing and the car's waiting for you when you get off at the station. You're under lights. It is a different world. That's what we need to do everywhere. And I'm sure this new government that's built around respect and all those other wonderful things that they'll be introducing we'll have a lot more of that. So, but don't ask blokes.
Oh, well, thank you for your.
Honestly.
It's nice that you've got a view that supports the rest of us. So, Anita, you have worked in this space as a policy advocate at a state level, meeting with the advisor to the Minister for Transport with some members of the policy team. What was it like getting to do the meet and greet and make your point with a state government decision maker? And have you got any advice on other volunteers who may feel tentative about doing this?
I think I was able to get through about the physical barrier that a lot of people experience with public transport, particularly getting on and off buses. And Amanda knows I'm only 150 centimetres tall, so that's always a barrier for me. But I don't think they realised the sort of barriers that people experienced. I think it was also interesting to talk to them about geographical areas and the problems that people had getting to various venues. I don't think they'd thought about that at all it was our discussions. And looking at problems that people experience, sometimes that you think, oh, I'm by myself with this problem. I'm sort of really upset about this problem. And it's important if you identify a problem, start to talk to your contemporaries, your social networks, your clubs, to see whether other people experience a similar problem. This is where particularly the death of a partner started with a friend of mine losing her partner, and it got bigger than Ben-Hur, and I started to talk to more and more people and recognise this was a major problem that people had, trying to change all their accounts, the legal problems and administration problems they experienced when a partner died. That's probably my best advice.
Yeah, thanks, Anita. Sound advice. Okay. Yes, Ruth.
The transport one, I had great difficulty trying to get a disabled parking ticket or parking card for a friend in residential care so that her friends could take her out. And that applying for that process needs to be reviewed, because it's ridiculous, the restrictions and the fact that it has to be verified by a physiotherapist or an occupational therapist or a GP. It just is a process that seemed to get so complicated and could have given that lady a lot more pleasure.
Okay, thanks, Ruth. We'll take that on board. Okay, so we're going to move on to housing, and not that this is a minor area at all, but we're hoping that we'll just get some top points. We'd like to acknowledge the work that Housing for the Aged Action Group do in this space. They're the leaders in this policy area, with COTA Victoria often supporting the work that they do. But Alexia, you've been involved in this work. What are some of the key focuses over the past 12 months?
So what we've been involved in COTA, particularly over the last few years, is the review of the Retirement Villages Act. COTA's been involved in advocacy around retirement villages for a long time, and I think we've all seen things on television about, the concerns of people who live in retirement villages. Often the contracts that people sign are very complicated. They don't necessarily realise all the implications of them when they sign them. Staff who work there may not be very well trained. And if you have a dispute, the process for trying to resolve a dispute can be quite complicated as well. Before the last election, the government undertook to review the Retirement Villages Act, and we've been on a stakeholder reference group, which is made up of other organisations such as HARG, the Consumer Action Law Centre, the Residents of Retirement Villages Victoria, the Commissioner for Senior Victorians, the Public Advocate, various people who are involved as a reference group in relation to the review of the Act. And myself and Dole Stitz, who I think is on this call as well, are the COTA representatives. Delle's the Brains Trust for us. She's done a huge amount of research looking at what happens in other states as well, so that we have some examples of other ways to resolve some of the issues that have come up. The government has put out an issues paper and an options paper, and we've had a number of quite deep discussions about various aspects of the Act. For us, some of the things that are important are that the Act has a rights-based approach for residents, and we're not so concerned about the rights of operators, but for us it's about the rights of the residents. And that also the relationship between retirement villages and aged care is clearer, because sometimes you have a residential aged care facility on the same block of land as the retirement village, and people sometimes move from one to the other and are not really clear that that means they're covered by different legislation. One's Commonwealth, one's state. There's a whole lot of differences in the conditions. and that it's important that people consciously make the decision if they're going to move. It doesn't just happen to them, and that they have the right to stay where they are if that's what they want and they're able to do so. And the other thing that we're concerned about is consistency between different parts of the housing system. So differences between, say, the conditions of residential tenancies versus retirement villages versus some other areas of housing that are not actually so clear what they're governed by, such as people living in caravan parks. So we've been involved also in review of the regulations for social housing, because that's another area where we'd like to see a greater consistency across in it, particularly things like how disputes are resolved, because, you know, there are disputes in all sorts of forms of housing, and we need a system that is easy for people to access and to use. What we're hoping is to see the new legislation before the next election, but of course we're running out of time. There's, you know, we've only got a few months till then. And we'll also be looking with some of the other kind of organisations such as HARG, but other ones as well, about what issues we'd want to raise before the next election. I think we saw at the federal election in May that housing is a huge issue. It's a very complex issue with lots of different aspects to it. Some of them are state, some of them are federal, and we need to be looking at, okay, what issues would we want to be raising at the state election in November? You know, there are issues such as homelessness, particularly for older women, but lots of other issues as well. So this is an area we've certainly concentrated on the retirement villages aspect over the term of this government, but going towards the election, we're also interested to look more broadly as well at what other aspects of housing we might want to focus on.
Yeah, thank you. It's a big topic area, that's for sure. And like all of the topic areas today, we're not doing them justice, but hopefully we're giving people a snapshot of the work that our volunteers and staff members are doing in this space. So we can't mention housing in the dead of winter without thinking about the rising cost of energy. I've just had a holiday in New South Wales, and I can tell you my feet are colder in Victoria. Alongside the increased costs of living. Anita, you've been representing the views of older people in this space on behalf of COTA Victoria. What are the top 3 challenges that you've been discussing in forums?
Older people are at home. They use energy both in winter and summer, and particularly over the COVID period. People didn't go out to clubs, they didn't go out to venues, they didn't go out to shopping centres. So they're at home using energy. Many older people use both heating and cooling because of health issues. Many older people have lived in their homes for a long time. These homes were often built when energy was not a problem. They have gas central heating, for example, and other forms of heating which are expensive. And many people at the moment are struggling to pay these bills. Now, the answer lately has been, well, you can close your doors and limit your energy use, but a lot of these homes are not designed physically to be able for that to happen. They're open plan living. The state government has developed both the heating and cooling upgrade and the 250 power saving bonus in the latest budget, and the comparison website to assist people. But these require people to apply and use them online, which is a barrier to a lot of people. And it comes back to my bugbear issue of the digital barrier. Most energy providers rely on online communication, which makes it difficult for people to, with any language, hearing, health problems. They rely on chatbots, which is probably the bane of a lot of people's lives. Chatbots don't answer your questions. Many people find that the security of their energy company is very difficult. And all you have to do is not be able to answer one tiny security question and they won't deal with you. A lot of people are very stressed by that ability, and I've just been speaking to someone in the last day about this. There's also a barrier with the energy companies that they won't deal with gas and electricity together. Even if one company, they won't deal with them together. But the main thing is that the cost of energy is increasing, but not older people's income. And so with people on an age pension or on a fixed income, it's a major problem and worry and concern for them. And as a consumer worker in this area, I am concerned a lot of older people will turn off their heating and cooling and not use it, and this will affect their well-being and their health.
Yeah, thanks, Anita. Great points to make, and a concern for all of us. And there's some comment. It's a long comment, so I'm not going to read that because we'll never get to the end of the. Thanks, Andrew Giles, for your comment from ACOS. And we'll get to your question, hopefully, Peter Clark, at the end. So assistive technology, Peter Wilcox, I'll throw to you. Unfortunately, we couldn't get the animation to work to show everybody in a succinct way what assistive technology is. Could you explain to us what the Assistive Technology campaign is, and have we made any headway? Are we getting somewhere?
Oh boy, have we made headway. I think initially I was one of the original members when I was approached to put the group together, and from there, you know, Andrew came on and other people did all the work, and it was wonderful. But the good thing was that so many peak bodies saw the need. They worked together so well. And we've made an enormous impact. We've made friendships and alliances with groups that we weren't expecting. We've learned how to work together. We've produced reports and studies through the universities. We've just presented a major paper to the government on the cost of providing assistive technology to all people throughout Australia. We've made a big difference, and assistive technology is some piece of equipment that enables people to live independently, and that's my interpretation. You can have all sorts of other things that you can use, but that's mine. And I was brought up with assistive technology. I was brought up with opportunities. I had calipers on my legs from the age of 4. I learnt to use other pieces of equipment to survive and thrive. I mean, I lived a very full life, and I still do that. I use over 30 pieces of assistive technology now daily. I'm in a powered chair. I've got all sorts of things that just make it work for me. I was joking before when you were talking, asking me about it. This is an example. I've got 3 of these around the house, and they're there for me, but I can afford them.
Yeah.
What about those people that can't? What about those people that don't know how to get access to them? Or the people that just because they're over 65, they're excluded to this non-means tested NDIS, which is something we just can't get our head around. The models that are being looked at are full of safety nets. They're full of contributions from clients. They're only part subsidies. They're for second-rate equipment. They're not for the quality equipment that's being provided through the NDIS. And yes, there's problems. Very few are getting the services they need through the NDIS. But I can tell you that the Assistive Technology for All group has let them know loud and strongly, so much so that the Department of Health called a special meeting with the Assistive Technology group yesterday. I think we were there for around about 3 hours. They listened intently. There's more work going on there. There's more direct conversations with members of the group, which will feed back into the new program. So, yeah, it's wonderful. And I can tell you, it wouldn't have happened if each of these groups had tried to do it independently. You're just overwhelmed when you see all these peak bodies on the one piece of paper.
Wow.
Yeah.
Yeah. That's great, Peter. And you know, acknowledging the work of your collaborators that are on the Zoom call, and especially our colleague Lauren Henley. There's also Andrew Giles has put in a link to the Assistive Technology for All website, encouraging you all to go and have a look at that. And Angela has put in a link to the animation that we could get the animation to work, but not the sound. But anyway, technical glitches.
One thing I would like to say, and this is a big shout out for Lauren. When Lauren first joined the COTA and the group, or she was with this group before she was with COTA, and I turned around to Lauren and I said, look, you're a youngster. what's in it? Why are you doing it? And Lauren just turned around and said, because it is wrong. It is so wrong, and it makes me cross.
Yeah.
That's Lauren.
Look, and she's just thanking you all in the chat as well. So yeah. Okay, so we haven't forgotten you, Greg. We've been waiting to get to you. With all of these policy areas, but in particular, there's some that have a national connection, aged care being a big one, housing being a big one, assistive technology, as just described. As president of COTA and chair of our policy development committee, sitting on the COTA Australia board, how do you link the state level issues or experiences into that national agenda?
Sure. Thanks, Amanda. So as you may all be aware, you may not be, but there's a COTA in each state and territory in Australia, plus one in Canberra. And each of the state and territory COTAs worry about the individual policy issues in their own state or territory. And COTA Australia worries about the national policies. And formally, there is a National Policy Council, which pre-COVID used to meet twice a year in Canberra for a whole day. Since COVID, that's been meeting online more regularly, but for less hours a day. So we meet probably 4 or 5 times a year. And the National Policy Council attempts to identify issues that are common across Australia, across all the states and territories. So, for example, we met this week, and COTA Australia, along with the states and territories, tends to pursue some agendas over many years because it often takes a very long time. So assistive technology is a good example. It's taken a number of years to get to the point where Peter's just explained the sort of the movement we've actually created at the national level, in particular around that issue. It's been going on, the campaign's been going on for Peter at least 8 years, 9 years, I think, long time. So similarly, there's a range of issues that span the country. Currently, we're discussing issues that relate in particular to women. Women in older age have a number of disadvantages. One comes from the superannuation policy in Australia, where women couldn't contribute to superannuation until I think it was the 1980s. And so often older women who are single, divorced, whatever, have very small superannuation balances. And there's one group in particular who are highly at risk, and that's single women who are renting privately are at risk, who are on pensions are at risk of homelessness. And so we tend to look at those issues. But having said that, the policy officers from each state, territory and nationally also meet on a more regular basis to canvass issues. And there is also a COTA Federation, which is all the state and territory COTAs plus COTA Australia, and the presidents meet along with the CEOs twice a year as well. Having said that, as you'd all be aware, our federation is a wonderful thing, but it makes policy complex because there's very few issues in Australia where it's either a state or a Commonwealth responsibility without one or the other being involved as well. So health is arguably the most complex. So currently in Australia, the Commonwealth Government shares with states responsibilities for funding hospitals. And so that's been going on as a debate currently in Victoria in particular around the Commonwealth's contribution towards hospitals. There's been a big push from the states to get that back to 50-50. It's currently sitting at about 45 Commonwealth, 55 states. Regardless of the proportion of spending at the Commonwealth state levels, it is still a cause of debate about whether we should actually be having. So in Australia has one of the highest bed usage rates of hospitals in the Western world. We don't invest very strongly in prevention and primary care. And when you look at comparisons between the average number of people who are in a hospital bed, Australia ranks either the highest or not, if not the highest. In the primary care space, the Commonwealth funds GPs through the Medicare system, but the states also fund, well, in Victoria, the state funds the community health program. In mental health, the Commonwealth funds separate mental health initiatives, state funds what used to be called the old area mental health services that are embedded in our regional hospitals. And so the list goes on. So it's very difficult sometimes to separate the activity. So for purely national issues though, so for example, the Royal Commission into aged care, the state COTA Victoria's role was basically to assist people to make submissions to the Royal Commission. So even where there's something that's happening nationally that may only be a national initiative, we tend to, if it's important enough for the population of older people, we will help people to be engaged and involved. And that's probably where the number of volunteers on the line today become even more important in helping people. So the sort of role that Ruth talked about that she's playing formally with the Navigator care trials, that's something that we'd like to see, I think more often, because people sometimes ask me, policy seems so removed and so remote from my life, whereas we've heard today the most compelling cases for changing policy is people's lived experience. So people live every day, have their own lived experience. And for example, I'm currently at war with Vic Roads about keeping my driver's licence because I stupidly told them when I had to renew my licence that I'm on a heart medication. Well, I've been going through the ropes with them and they do not communicate really well. So, and I'm the president of COTA and I'm meant to be reasonably assertive. I'm still failing to get, and so people who are less assertive and have less knowledge than I might struggle often with bureaucracies, and so it's that lived experience that's really important. So we try to say that while there are some mechanics and some issues around policy that people struggle to understand, it's actually that lived experience that actually supports and underpins all the stuff, all the policy work that COTA Victoria and the rest actually do as well.
It's at the crux, and I guess that's why today you see, one staff member, but the rest are volunteers speaking in this space. And for those of you who are participating and listening, that's because we tend to really rely on, the work, the experiences of older people. We value what you're living through, what your community that you are part of lives through. So thanks, Greg. It's good to know the connection and even that fine balance between federal and state issues, which is a good segue to an upcoming election in COTA Victoria. Now we're running out of time, so I just wondered if everybody out there that's listening might put in the chat, if you can find the chat function in your keyboard, 3 of the top issues for older people that you'd like to see prioritised by the Victorian government in the upcoming election. And I'll just ask each of the panelists to mention one. So one issue, that I'll ask you to speak to them, panelists. So Anita, what would be one? I know that you've got more than one. Let's not,
Okay.
But yeah, just one state Victorian government election issue.
Well, Lexi will know what I'm going to say. It needs a review of the Victorian concessions, which haven't been reviewed for about 40 years. And Ruth touched on this before, that they're too difficult for people to get. Medical cooling off concession is a typical concession which no one qualifies for. So that needs to be totally reviewed so more people can access concessions and even know that they're there to help them.
Okay, great. Ruth, have you got an area you'd like to be included?
The aged care process, applications and inquiries be made less complex.
Okay, all right. Yes, and there is still, we are Victorian citizens, even if it's a federal issue in aged care, it's still, there is, local level or state level providers as well. Rhonda, would you like to speak to yours that you've put in the chat? Oh, you're on mute.
I'm going to nominate ageism because I think it covers just about everything, including, the government's attention to this group. So I think it covers employment, it covers housing, it covers, you know, the support mechanisms that are in place for older persons. And I think we need a public education program so that eventually ageism is as readily recognised as sexism and racism is now.
Yes, here, definitely agree with that one. Thank you. Peter.
Wow, I didn't know the question was coming, but here we go.
Just make it up.
No, it's a community visitor scheme in partnership with local councils that is particularly directed at the age sector. We've got plenty of people willing to volunteer if they're getting proper supervision and proper guidance. Let's not give it to private enterprise. Let's do it through the council, where they'll get public funding, they'll get donations, the whole thing. I mean, just like Meals on Wheels again, wonderful old thing that the councils used to run back in the 60s. We can do it with you know, getting volunteers out there doing things, and it's not that expensive to do.
Yeah, thanks, Peter. And I know that it already works well because of I'm a community visitor in SRSs. So yeah, and it's also, that point is included in our policy position paper around the role of state government in that aged care space. And Angela, thank you for putting the links up in our chat. Alexia, top issue or one of your top issues for the state government?
Something we haven't talked about today, which is more funding for the prevention of elder abuse. We've seen a lot of money put into family violence in Victoria, which is fabulous. I mean, elder abuse is a form of family violence and it does get some funding, but a hell of a lot more could be done to raise awareness of what is elder abuse and how to prevent it, both at the individual level but also at the community level.
Yeah, thank you. Absolutely. And Greg, you get the final word on the election priority for the Victorian state government.
Thank you, Amanda. So COTA Victoria is really, while we have a very active Commissioner for Ageing in Victoria, we have a minister whose portfolios, I think, with the reshuffle last weekend, the Minister for Ageing has, I think, 3 or 4 other portfolios. So we're very keen to see a greater focus on ageing in the cabinet, Victorian cabinet, because since the advent of my aged care and the transfer of the old HAC program funding to the Commonwealth, the state has really not abrogated its responsibility, but has really clearly only focused on things like the seniors card and the yearly festival for seniors as its major initiatives, whereas, as we know, COVID in particular shone a huge light on the disparity in terms of health status and the outcomes since we've gone out of lockdown. The actual number of deaths that are occurring in Victoria and across Australia is a scandal.
Absolutely.
As people keep saying, if that means the number of people who are dying currently from COVID were dying in car accidents, we'd say there was, you know, we needed to do something in a hurry, but we seem to have decided that's okay, and that burden of death sits, not totally, but a fair amount of that pain is being actually shared by older people. So
yes, definitely, and let alone the repercussions of all of the lockdowns we've had here in Victoria, some of which have been touched on by the topics that people have raised in the chat, including social isolation, which we didn't get to today. So thank you to our panellists, to our COTA President and Chair Greg Nichols, to our Policy Development Committee members Peter and Rhonda, to our peer educator and aged care navigator Ruth Hosking, and to our policy advocacy volunteer Anita. If you could please join with me in clapping your hands, even if silently. And I'd like to now throw to Alexia, who's going to do the wrap up for the day. Thanks, Alexia.
Okay, well, it's been a bit of a cook's tour of a number of different policy issues. So I hope it's been useful in giving a sense of the broad range of issues that COTA is dealing with in terms of policy. And of course, that's the case because any policy issue is going to affect older people. And so we are looking always at a diversity of issues. In that, we need to juggle having a focus on some issues so we can get the depth that we need in terms of work on them. So I think we've talked about some of those today, such as our work on retirement villages and assistive technology, which take time over many years. And then there are other issues that we're responding to invitations. We get a huge number of invitations to be involved in consultation processes. And as you would guess from what we've talked about today, our approach increasingly is to support older people to represent in those consultations, and that, we see the role of the organisation as to support people to do that, because that's where the lived experience comes from and the genuine voice in those kind of consultations. It's not for the staff to go and, represent on behalf of older people, although in some cases we can be both. So if people want more, I think Angela or Amanda already put into the chat where we've got our policy positions on our website, and it talks about our priorities, etc. And all I'd like to do in closing is really to thank not just the presenters, but everybody for attending and for the contributions people have made in the chat. I mean, that's been really great too. There's been some great comments there. And a particular thanks to Amanda and to Lauren and to Angela for bringing all of this together, and to Amanda for doing a mighty job in facilitating the whole 2 hours. I think that, that's really an achievement as well, to hold us all together